Do you need to take supplements? First of all, diet first and foremost. You cannot cheat your way out of having a good diet just by taking supplements. Your diet should be the primary source of nutrients. It's what your body recognises and used for its source of nutrients for thousands of years. So when it comes to supplements, we want quality and we want as close to a food source form as we can get for the best results. So foods primarily, but there is definitely a place for supplements as well. And I often get asked, but how do you know people are deficient? I talk a lot about how people are quite likely to be deficient in certain nutrients such as magnesium or vitamin D and should therefore be taking supplements in most cases. And people ask, but how do you know? So first of all, the research. There is research to suggest that we are highly likely to be deficient in certain nutrients in Western societies. This is for a number of reasons. Our diet has changed over time. The quality of food is more processed than ever. The quality of the soil has depleted. And so we have symptoms, we have risk factors. Symptoms can be mental, physical, low immunity, poor sleep, stress. The risk factors can overlap to some degree because stress is another risk factor. Diet, as we've mentioned, medications can deplete your nutrients, including the hormonal contraceptives. Alcohol can deplete. So as we can weigh up the likely deficiencies with the symptoms and the risk factors. But you can also get tests. If you'd rather get tested, you can go to your doctor for certain tests such as vitamin D, magnesium in some cases, or you can go private and pay for tests for a wider range of nutrients or more specific results. So you can check if you want to. But what I would say often for some of these nutrients, such as magnesium, for example, is why not try it? Why not try taking one and see how you feel? See if you notice a difference, then you're likely to be absorbing that magnesium and putting it to good use. Also, when I mentioned the doctor's test, you should also consider what parameters they are using. So doctors will, they are looking for disease basically. So do we want to be told you're not at risk of chronic diseases, so you're fine? Or do we want optimal levels? So then we have the option of standalone nutrients or multivitamins, or most people do well on a magnesium and a vitamin D kind of minimum. But then there are kind of wider spectrum multi-nutrients that people also do very well on. There's some that I often recommend for people, for women who are experiencing PMS or perimenopause symptoms. Sometimes they need a top up in a wider spectrum of nutrients and they can do really well on that. But long story short, I think there definitely is room for supplements, but diet absolutely first and foremost should be the priority, and then very often there are lovely supplements out there that can make a positive difference.